Depending on your medical condition, you may need to take anticoagulation medicines or blood thinners during treatment at MD Anderson Cancer Center. If your healthcare team prescribes an injectable subcutaneous anticoagulation medicine, you will inject the medicine into the fatty tissue under your skin. There are 4 injectable anticoagulation medicines. Enoxaparin, brand name Lovenox, is injected 1 to 2 times a day. When you take it 2 times a day, take it every 12 hours. Dalteparin, brand name Fragmin, is often injected once a day. When treating blood clots, the dose is higher for the first 30 days. You should notice a change in the color of the syringe at the start of the 2nd month. Fondaparinux, brand name Arixtra, is injected once a day. It may be hard to find dalteparin and fondaparinux in a pharmacy outside of MD Anderson. Call your local pharmacy to make sure they have a supply. Heparin helps prevent blood clots after surgery. It is injected 2 to 3 times a day. If you miss a dose of your medicine, review the Injectable Anticoagulants Patient Education document on MyChart for instructions. Common injection sites include your stomach, top of your thighs, or the back of your upper arms. However, patients who use their stomach as the injection site see the best results. Review the Injectable Anticoagulants Patient Education document for more information on injection site locations. For children, injections are often given on the outer thigh. Talk with the child's doctor about the best location. You will need an alcohol pad, cotton ball, syringe with medicine, and a sharps container. Wash your hands with soap and water for at least 20 seconds and dry them. Clean the injection site with the alcohol pad and let it dry. Remove the cap from the medicine. To ensure you get the correct dose, do not get rid of any bubbles in the syringe. Enoxaparin may need to be given in partial doses. For example, a 100 mg 1 milliliter syringe may be dispensed. However, you may only need to take 90 milligrams, 0.9 milliliters. In this case, point the needle downward, open the cap, and push the plunger down to remove some of the medicine onto a cotton ball until the top of the liquid bubble reaches 90 milligrams or the 0.9 mark. Enoxaparin and dalteparin may also need to be drawn from a vial before injection. Remove the plastic cap from the vial and clean the stopper of the vial with an alcohol swab. Then let it dry. Open and attach the needle to the syringe. Draw air into the syringe by pulling the syringe plunger back to the line of the dose your doctor has prescribed. Remove the cap from the needle and push the needle into the vial. Turn the vial upside down. Push the air into the vial and pull back the needle so that only the tip remains in the stopper. Pull the plunger back until the black line is at the dose ordered by your doctor. Check for air bubbles, and if needed, push the plunger back in to remove the air and draw out more medicine. Remove the needle from the vial. Do not touch the needle at any time. When the medicine is ready to administer, pinch some of the fat in the injection area. Insert the needle directly into your skin at a 90-degree angle and push the plunger in slowly to give the medicine. Thinner patients and children can inject at a 45-degree angle. Remove the needle from your skin. Place a cotton ball on the injection site if bleeding occurs, but do not rub the injection site. Some pre-filled syringes have safety shields. To activate the safety shield, press down firmly on the plunger, then throw it away in a sharps container. If you don't have a sharps container at home, you can use a coffee can, milk jug, or laundry detergent jug to ensure others don't get stuck by the needle. When you are ready for your next injection, choose a new spot to inject each time. If you are in the hospital, you may receive the first dose of this medicine while there. When you go home, if you are to take this medicine 2 times a day, slowly adjust the timing to what is best for you. Review the Injectable Anticoagulants Patient Education document for examples on how to adjust the timing. This information is in the Home Dosing section. The doses for these medicines, except for heparin, are based on your weight. Weigh yourself every week. If you gain or lose more than 10 pounds, tell your healthcare team. Ask for a copy of the following patient education documents or view them in MyChart. Atrial fibrillation. deep vein thrombosis, injectable anticoagulants, enoxaparin, Lovenox, dalteparin, Fragmen, fondaparinux, Arixtra, and heparin, pulmonary embolism. If you have any questions, send them to your healthcare team through MyChart. If your concern is urgent, call your center and ask to speak to a nurse. If you need to reach someone after hours and weekends, call Ask MD Anderson.